She's just a student nurse. Chief Surgeon Dr. Marcus Webb didn't even look up from his phone. Get her out of my ER. She kept her head down, scrubs 2 sizes too big, hands trembling as she restocked supplies in the corner. Nobody knew. Nobody could know. Then the doors exploded open. Secret Service, guns drawn, blood everywhere. POTUS detail down. GSW to the chest. We need a trauma surgeon now. Webb froze. The monitor screamed. Flatline in 60 seconds. That's when her hands stopped shaking. Step aside. Her voice cut through the chaos like a scalpel. They didn't know what she'd done in Kandahar. They were about to find out. The Secret Service agent hit the ER floor with a wet, heavy sound that made every head turn. Blood spread beneath him in a growing pool, dark and arterial. Fast, too fast. Dr. Marcus Webb's phone clattered to the floor. Trauma protocol, his voice cracked. Get me vitals. Someone get me vitals now. Nurses swarmed. Monitors shrieked to life. BP 60/40 and dropping. Oxygen sat 82. Heart rate 140 and climbing. Webb's hands shook as he snapped on gloves. The chief surgeon, 20 years of experience. But his fingers fumbled with the trauma shears, nearly dropped them twice before cutting through the agent's blood-soaked shirt. Agent Martinez burst through the doors behind the gurney, weapon still holstered but hand hovering over it. His eyes locked onto his partner's gray face. Talk to me. What's his status? Webb pressed his stethoscope to the agent's chest, left side, right side. His face went pale. Pneumothorax, collapsed lung. We need a chest tube. Someone get me a chest tube kit, now. Martinez stepped closer. How long does he have? We're working on it. How? Long. Webb's jaw clenched. Minutes, maybe less. He's got 90 seconds before brain damage starts. Martinez's voice cut through the organized chaos like a whip crack. 90 seconds. In the corner, partially hidden behind a supply cart, she watched. Her hands had been trembling 30 seconds ago, shaking so badly she'd dropped a box of gauze. Another student nurse had laughed, just nerves, first-week jitters. Now her hands were perfectly still. She saw what Webb couldn't see, what he wasn't looking for. The blood pattern. Not from the gunshot wound in the shoulder, from deeper, the way the chest rose on one side, barely moved on the other, the venous distension in the neck, the specific shade of cyanosis creeping into the lips, subclavian artery rupture. Her mind calculated automatically. 17 times. She'd seen this exact injury 17 times. Helmand Province, Mosul, Kandahar, different uniforms, same wound, same countdown, 40 seconds until cardiac arrest, maybe 15 after that to bring him back. Maybe. Webb positioned the chest tube kit on the crash cart. His hand steadied slightly as muscle memory took over. He palpated the ribs, counting spaces. 4th intercostal space, mid-axillary line, standard. Placement for pneumothorax. Wrong. Completely wrong. She felt her feet move forward. One step. Her mouth opened. They'll find out. The thought hit her like a physical blow. She froze. They'll know. They'll ask questions. They'll dig into her past, her records, her reasons for being here in oversized scrubs with a student ID badge. Everything she'd run from would catch up. The agent's body convulsed. Once, twice, seizure. He's seizing. A nurse grabbed for restraints. Webb's scalpel hovered over skin. Hold him still. I need to get this tube in. Martinez's voice went raw. Do something. The monitor's rhythm changed. The steady beep fractured into chaos. V-fib, ventricular fibrillation, heart quivering uselessly instead of pumping. She watched Webb position the scalpel, watched him angle it toward the intercostal space, watched him prepare to insert a chest tube that would do absolutely nothing for a subclavian rupture. Watched the monitor flatline. Her voice came out quiet, absolutely certain. You're killing him. Webb's head snapped up. His eyes found her in the corner. Narrowed. Excuse me. She stepped forward into the light. Blood on the floor. Blood everywhere. That's not pneumothorax, subclavian rupture with hemothorax. You're 30 seconds from losing him. The ER went silent except for the scream of the monitor. Webb's face flushed crimson. Security, remove this student from my ER immediately. Wait. Martinez's hand went to his weapon, not drawing it, not yet, but the threat was clear. Say that again. She didn't look at Martinez, kept her eyes on the dying man. Subclavian artery, ruptured, bleeding into the chest cavity. Your chest tube won't reach it. He'll be dead in 30 seconds. Webb's voice went cold. I am the chief of trauma surgery. You are a first-year student. You will leave now, or I will have you arrested for interference. Martinez drew his weapon, pointed it at Webb. She sounds like she knows what she's talking about. His voice was steady despite the gun in his hand. Let her work. Time slowed. Webb stared at the weapon, at Martinez, at her. She didn't wait for permission. Her hands moved to the crash cart. No trembling now, no hesitation. 20 years of training compressed into pure instinct. Scalpel. A nurse handed it to her, uncertain. Rib spreader. Another nurse scrambled to find it. Vascular clamps, move. The equipment appeared in her hands as if summoned. Nurses responded to the authority in her voice without thinking, without questioning. Webb tried once more. You can't possibly... Her scalpel was already cutting. Clean incision, third intercostal space, exactly where it needed to be. Blood welled up. She didn't flinch. Rib spreader. She inserted it, cranked it open. Ribs separated with a sound like breaking branches. Her hands disappeared into the chest cavity, precise, calculated, perfect. Fingers finding the torn vessel by feel alone, by memory. By the 17 times she'd done this. Exact procedure under mortar fire. Found it. Her voice remained calm, clinical. Intercostal vessels compromised. Massive transfusion protocol. Now. A resident stared. The subclavian? Clamped. Get me 4 units O negative. He's losing faster than we can replace. She worked in silence. Her fingers sutured torn tissue, applied pressure, released, checked, adjusted. Webb stood frozen 3 feet away, watching a student nurse perform emergency thoracic surgery in his ER, on his patient, while he did nothing. Martinez lowered his weapon slowly. His eyes never left her hands. Who the hell are you? She didn't answer, just kept working. Tie off the vessel, check for additional tears, none. Clear the blood from the cavity, insert proper drainage, close the clamps, step back. The monitor's scream changed. Beep, single, steady, beep, regular rhythm returning, beep. BP 80/50. A nurse's voice, awed. Climbing, 90/60. The agent's chest rose, fell, rose again, even, bilateral, normal. She stripped off her gloves, dropped them in the biohazard bin. Blood soaked her scrubs, covered her arms to the elbows. A single drop ran down her cheek like a tear. Martinez stared at her, at his partner, back to her. What's your name? She looked at him, at Webb, at the dozen nurses and residents who'd witnessed everything, at the secret she couldn't keep anymore. Rivera, she said quietly. Maya Rivera. Webb found his voice, barely. That's impossible. You're a student. Your file says... I know what my file says. Martinez holstered his weapon, pulled out his phone. His hand shook as he dialed. This is Agent Martinez. I need immediate contact with Army Medical Command, General Hartwick if she's available. Pause. Tell her it's about Captain Rivera. Yes, Captain. Tell her I found her. Maya closed her eyes. 3 years. She'd hidden for 3 years. Now it was over. The ER doors burst open again. Hospital administrator, security, more agents. But all Maya could see was the monitor. Beep, 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 still alive. One more save, one more chance. Maybe this time it would be enough. The agent was stable, vitals holding, blood pressure climbing steadily toward normal. 2 nurses wheeled him toward the ICU, monitors beeping their steady rhythm of survival. Maya stepped back from the gurney. Blood covered her scrubs, dried on her forearms, crusted under her fingernails. Her hands were still steady. The ER had gone silent. Every nurse, every resident, every technician, all of them staring at her like she'd just walked on water. Dr. Webb's face cycled through emotions too fast to track. Shock melting into anger, anger hardening into humiliation. His mouth opened, closed, opened again. Martinez approached her slowly, carefully, the way you approach something dangerous. That was combat medicine. His voice was quiet, respectful. I've seen it in Baghdad, the speed, the certainty. Where did you serve? Maya didn't answer. She turned, toward the exit. 1 foot in front of the other. If she could just make it to the door, if she could just disappear again. Nobody moves. Webb's voice cracked like a whip. Security, detain her, now. 2 guards stepped in front of the exit, hands on their belts, not threatening, not yet, but blocking. Maya stopped walking. The ER doors burst open again. Dr. Patricia Reeves swept in, hospital administrator, flanked by 3 more security officers. Her heels clicked against linoleum, sharp, precise, the sound of institutional authority. She took in the scene with cold eyes, the blood, the trauma bay. Maya standing in the center of it all. Webb found his voice again, found his authority, clung to it like a lifeline. That woman just performed unauthorized surgery. He pointed at Maya. His hand shook. She's a first-year student. We don't even know if she's licensed. She could have killed that agent. She violated every protocol we have. Martinez stepped between them. She saved a federal agent's life, my partner's life. The White House will want to thank her personally. Maya's voice came out flat, empty. I don't want thanks. I want to leave. Reeves studied her. Clinical, calculating, the way you study a problem that needs solving. Your student file lists no surgical experience, no military service. Where did you learn thoracic surgery, Ms. Rivera? Silence. Maya's jaw clenched. She stared at the blood on her hands. Webb seized the moment, his confidence returning, building. She's probably lying about her credentials. Pull her file, call the nursing board, check her background. I want answers before she sets foot in this hospital again. One of the security officers pulled out a tablet, fingers swiping through screens, finding her student application, reading it aloud. Name, Maya Rivera, previous experience, certified nursing assistant, private sector, education, community college, no advanced degrees, no military service listed. He looked up. No surgical training whatsoever. Reeves's expression didn't change, but her voice dropped 10 degrees. Ms. Rivera, you are suspended pending investigation. Possible fraud charges, possible criminal charges for practicing medicine without a license. Do you understand? Maya's jaw clenched harder, but she said nothing. Martinez pulled out his phone, stepped away. Low, urgent conversation that no one could quite hear. Webb's voice carried triumph now, vindication. I want her credentials pulled. I want her student status revoked. I want a full investigation into how someone with no medical training managed to enroll in this program. He turned to Reeves. This is a liability nightmare. We could lose our accreditation. Martinez returned. He held out his tablet. A video call connected. Face on screen, military uniform, stars on the collar, steel gray hair pulled back tight, eyes that had seen too much. General Amanda Hartwick, Army Medical Command. Her eyes locked onto Maya. Captain Rivera. Her voice carried across the silent ER. It's been 3 years. The room went still. Webb's face went blank. Captain? Hartwick's expression didn't soften. Captain Maya Rivera, Army trauma surgeon, 3 tours of duty, Kandahar, Helmand Province, Mosul. She paused. Let the words sink in. 248 combat surgeries performed in theater, 94% survival rate in field conditions, the highest survival rate of any combat surgeon in theater. Maya's face remained stone, but something flickered behind her eyes. Hartwick continued, her voice harder now. Until Operation Sandstorm, Maya flinched, first crack in the armor. 17 casualties in 4 hours, mass casualty event, mortar strike on a forward operating base. She saved 16 of them. Martinez's voice was quiet. And the 17th? Long pause. The monitor beeps from other patients filled the silence. Maya's voice came out barely above a whisper. My fiancé, Lieutenant James Porter, medevac pilot. The weight of those words pressed down on everyone in the room. Hartwick's face softened. Barely. His helicopter was shot down bringing in wounded from the strike zone, spinal trauma, internal bleeding, massive hemorrhage. She looked at Maya. Captain Rivera operated for 6 hours straight. Maya's eyes closed, her hands balled into fists. I couldn't stop the hemorrhage. I couldn't. Her voice broke. First time, only time. My hands wouldn't stop shaking. Silence. I watched him die on my table while 17 other soldiers waited outside that tent. 17 soldiers who needed me, who I could have saved if I hadn't been trying to. She stopped, swallowed hard. I left the army the next week. I couldn't be responsible for anyone else. No one moved. No one spoke. Webb's voice came quieter now, but still defensive, still clinging to procedure. That still doesn't explain why she's here under false pretenses, why she lied on her application. Maya's eyes opened, met his. I am a CNA. I am a student. I didn't lie. I just didn't tell you everything. Her voice steadied. I wanted to start over, to be someone who couldn't kill people by making the wrong choice. Reeves's voice cut through, cold, administrative. You practiced medicine without authorization in this hospital. That's a felony, captain or not. Martinez stepped forward. She saved my partner's life when your chief surgeon was about to kill him. Webb's face flushed. Hospital policy clearly states that the alarms cut him off, loud, blaring, throughout the entire ER. Every screen, every monitor, red lights flashing. A nurse burst through the doors, young, panicked. Mass casualty alert, multi-vehicle accident on Interstate 95, 12 critical incoming, ETA 4 minutes. The ER exploded into motion, nurses prepping bays, residents grabbing equipment, organized chaos. Reeves turned to Webb, her voice perfectly level. This is your ER, doctor. This is your call. Webb's face went pale, sheet white. His hands started shaking again. 12 critical patients, 4 minutes. They both knew, everyone knew. He wasn't equipped for this. Maya stood motionless, every instinct screaming at her. The old training, the old reflexes, the old terror. Martinez's voice cut through the alarm. Captain Rivera, we need you. Webb's head snapped around, pride wounded, authority threatened. Absolutely not, she's suspended. She's not authorized to... The radio on the nurse's belt crackled. Dispatch voice, urgent. Be advised, victims include a school bus, multiple pediatric traumas. Repeat, multiple pediatric traumas. Maya's eyes snapped open. Pediatric traumas. The words hit her like a bullet, like a mortar strike, like the sound of James's monitor flatlining. She saw his face, blood on his lips, his hand reaching for hers. Then she saw the 17 soldiers, waiting outside, bleeding out while she tried to save the one person she couldn't lose. Her hands balled into fists, knuckles white. 4 minutes, 12 critical patients, children, one chance to redeem it all, one chance to save the ones waiting outside, or one chance to fail again, to freeze, to watch her hands shake while people died. The alarms kept screaming, the clock kept ticking. Maya stood perfectly still and made her choice. Maya looked at her hands. They weren't shaking, not even a tremor. Her voice came out steady. Command voice, captain voice. How many pediatric cases? The nurse checked her tablet, hands trembling. 5 critical, ages 6 to 14, multiple crush injuries, internal bleeding, possible head trauma. Webb straightened, found his authority again, clung to it. I'll take lead. Residents prepare trauma bays 1 through 5, standard protocols. We follow procedure. Maya's voice cut through like a scalpel. You'll kill them. Direct, cold, true. Webb's face flushed crimson. I am the chief of trauma surgery at this hospital. I have 20 years of... You fumbled a chest tube on a single patient. Maya's eyes locked onto his. You want to triage 12 criticals, 5 of them children? Silence. The alarms kept blaring. The clock kept ticking. Martinez stepped forward, looked at Reeves. Let her work. I'll take full responsibility, federal authority, whatever you need. Reeves calculated. Hospital liability, federal pressure. A chief surgeon who'd already failed once today. A suspended student who just performed a miracle. Dr. Webb remains supervising physician. Her voice carried the weight of institutional protection. Captain Rivera acts as consulting surgeon. Temporary emergency authorization. Webb's jaw clenched, humiliated, outmaneuvered. But he nodded once. The ambulances arrived, sirens screaming, doors flying open, carnage spilled into the ER, blood, screaming, parents frantically calling names, a child's shoe on the floor, just one, small, pink. Maya stood perfectly still for 3 seconds. Her eyes tracked everything, categorizing, triaging, calculating. Survival chances in her head, blood spatter patterns, breathing rates, skin color, level of consciousness, 3 seconds. Then she moved. Red tags to trauma 1 through 3, yellow tags to 4 and 5, green tags to urgent care. Move now. Her voice carried absolute authority. Nurses responded without thinking, without questioning. The chaos organized itself around her like iron filings around a magnet. First critical hit the bay. 8-year-old boy, steering column impaled in his abdomen, blood pressure dropping, skin gray. Webb approached, hesitated, reached for the boy's wrist to check pulse. Maya was already gloved, already moving. Peritoneal bleeding, possible liver laceration. He's got maybe 6 minutes before he bleeds out. Her hands moved over the boy's abdomen, palpating, assessing. Webb tried to assert control. We should wait for CT, get a full picture before He'll be dead before the scan finishes. Maya's scalpel was already cutting, clean line, precise. Laparotomy, now. She opened the abdomen, blood welled up, dark, venous. Her hands disappeared inside. No hesitation, no wasted movement, finding the tear by touch, by memory. By the 17 times she'd done this exact procedure. Found it. Hepatic vein tear. Clamp. A nurse slapped the instrument into her palm. Maya clamped the vessel. The bleeding slowed. Stopped. Sutures. 4 neuroproline. Her fingers moved, tying knots. Perfect tension. Not too tight, not too loose. 4 minutes later, she stepped back. He's stable. Next. Second critical. 14-year-old girl. Chest not rising properly. Lips blue. Oxygen sat in the 70s. Maya didn't break stride. Tension pneumothorax, needle decompression, second intercostal space, mid-clavicular line. She performed it while simultaneously calling orders to a resident working on a third patient across the bay. Dr. Kim, pelvic fracture right side. You're looking at internal iliac bleeding. Clamp it before you lose him. Webb watched, tried to keep up, couldn't. She was running 3 traumas simultaneously, hands working on one patient, eyes tracking another, voice directing a third. Impossible. But she was doing it. Third critical. 10-year-old boy. Femoral artery rupture, blood pumping out with each heartbeat. The resident working on him panicked. I can't find the bleeder. There's too much blood. I can't see. Maya didn't even look up from her own patient. 2 centimeters medial to where you're looking. Deeper. You're too superficial. Clamp now. The resident adjusted. Found it? Got it. How did you? I can hear the blood flow pattern. Move faster. He doesn't have time for questions. 4th critical, 5th, 6th. Maya moved between them like a ghost, like smoke, everywhere at once. Residents followed her commands without hesitation, without doubt. Webb stood frozen, watching his ER transform, watching a suspended student run mass casualty triage better than he ever could. Then the last ambulance arrived. Doors burst open. 6-year-old girl, massive head trauma, blood-matting dark hair, eyes rolled back, pupils blown. Martinez saw her. His face went white, then gray. No, no, Chloe! He stumbled forward, caught himself on a gurney. His niece, his brother's daughter, the one who called him Uncle Rico and drew him pictures of superheroes, on the table, dying. BP 60/30 and dropping. Pupils non-reactive. GCS 3. Webb approached, looked at the monitor, at the child. His voice came out quiet, defeated. There's nothing. We can't. The trauma is too severe. Maya's hand stopped for 1 second. She saw James on that table, blood on his lips, hand reaching for hers, saw her own failure, her hands shaking, the hemorrhage she couldn't stop, saw the 17 soldiers outside, waiting, dying while she tried to save the one that mattered. Then she saw Martinez's face, saw a man watching his niece die. Her hands moved. Get me a cranial drill and mannitol. We're doing an emergency burr hole. Now. Webb's voice cracked. Captain, that's a neurosurgeon's procedure. We need to call. I've done it 12 times in field conditions. Maya's voice stayed level. We don't have 12 minutes for a neurosurgeon. We don't have 12 seconds. She didn't wait for permission. The drill appeared in her hands. She palpated the skull, found the fracture, the pressure point. Everyone in the ER stopped working, stopped moving, all eyes on her. She drilled, bone dust, blood, the sickening crunch of metal through skull, released the pressure, dark blood and fluid drained out. The monitor flatlined, continuous tone, no heartbeat. Maya dropped the drill, started CPR with one hand, her other hand still inside the skull, managing the intracranial bleeding. Impossible. One person couldn't do both, but she was doing it. Epi, 1 milligram, now. A nurse injected it, pushed the medication through the IV. Maya compressed the chest. 1, 2, 3. Perfect rhythm. Shock, clear. Everyone stepped back. The defibrillator fired. Chloe's small body convulsed. Nothing. Flatline continued. Again. Another shock. Nothing. Maya's voice cracked for the first time. Come on, Chloe, come on. She thought of James, of the moment she'd failed, of her hands shaking while he died. She thought of the 17 soldiers, the ones she'd abandoned to save someone she couldn't save. Not this time. Not this time. One more shock. The monitor changed. Beep, single, weak, beep, stronger now. Beep, 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 regular rhythm. BP 70/40, climbing. Pupils responding to light. Chloe's chest rose, fell, rose again. Martinez collapsed against the wall, sobbing, hands covering his face. Maya stepped back, stripped off her gloves, blood-soaked, everything blood-soaked. She looked around the ER. 12 trauma bays, 12 critical patients, 12 steady monitor beeps, 12 saves, 0 losses, every doctor, every nurse, every resident, all of them staring at her. Webb stood, frozen, his authority gone, his confidence shattered, everything he thought he knew about medicine dismantled in 40 minutes. Reeves's voice cut through, quiet, final. Dr. Webb, my office, now. Webb didn't argue, didn't protest, just walked toward the exit like a man going to his execution. He stopped halfway there, turned, looked at Maya. Long moment, heavy silence. I was wrong. His voice came out quiet, broken. About everything. Maya nodded once, no triumph, no satisfaction, just exhaustion. Webb kept walking. Reeves followed. The door closed behind them. Maya stripped off her blood-soaked scrubs, down to her undershirt, covered in red. She walked toward the exit, one foot in front of the other. Autopilot. Martinez blocked her path, tears still on his face. Captain, thank you doesn't. I can't even. Maya looked at him, at the man who'd just watched his niece die and come back. Your niece fought hard, that's all. She stepped around him, kept walking. But she didn't make it to the door. Reeves intercepted Maya at the door. Captain Rivera, wait. Maya turned, exhausted, every muscle screaming, expecting more bureaucracy, more questions, more accusations. Reeves's expression had changed, softer, almost human. Dr. Webb has been placed on administrative leave, pending investigation into his judgment. She paused. His competence. Maya said nothing, just waited. I'm offering you his position. Chief of Trauma Surgery, full credentials restoration, full authority, full medical staff privileges. Maya stared at her, the words not quite processing. Reeves continued, You'd be the youngest chief in this hospital's history. We both know you're qualified, more than qualified. Silence stretched between them. Maya's voice came out quiet, raw. I left the army because I failed, because I couldn't handle the responsibility anymore, because my hands shook and someone died because of it. Martinez stepped forward, his face still tear-streaked. Captain, you saved 12 people today, including my niece. I lost one person, the only one who mattered. Reeves's voice softened further. And that's exactly why you're the right person for this job. You understand the weight of every decision, the cost of every failure. That makes you better, not worse. Maya looked back at the ER. Nurses cleaning blood from the floors, patients stabilized in their bays, families reunited, holding each other, crying relief instead of grief. She saw Chloe Martinez being wheeled toward the ICU. Stable. Parents walking beside her gurney, holding her small hand. She saw the empty trauma bay. In her mind, James lay there, blood on his lips, hand reaching for hers, the monitor flatlining while she failed. But in reality, the bay was empty, clean. Ready for the next patient, the next save. I can't replace what I lost. Martinez's voice came gentle. No, but you can honor it. Long silence. Maya's hands flexed once. Steady, no tremor, no shake. Those hands had failed once. They wouldn't fail again. I have conditions, Reeves nodded. Name them. Maya's voice strengthened, command voice returning. I want a combat medicine training program for civilian trauma surgeons. Teach them what I learned in theater, the things medical school doesn't cover. Reeves listened, calculating, considering. I want veteran medical professionals prioritized for hiring. They have skills no textbook teaches, experience no classroom provides. Martinez smiled slightly. Maya's voice dropped, softer now, more personal. And I want a memorial in the ER for the medics and surgeons who didn't make it home, so everyone remembers what they gave. Reeves extended her hand, no hesitation. Done. All of it. Maya looked at that hand for 3 seconds, then shook it. Chief of Trauma Surgery, Dr. Maya Rivera, 6 months later. Maya walked into the ER wearing a white coat, Chief embroidered on the pocket, her name underneath, morning rounds, 5 residents trailing behind her, hanging on every word. The ER had changed, signs on the walls, Rivera protocol for mass casualty triage, step-by-step instructions, the system she'd developed in Kandahar, now standard procedure, combat medicine training center on the 4th floor, dedicated 2 months ago. The plaque by the door read, the Lieutenant James Porter Center for Advanced Trauma Care. Maya passed it every day, touched the letters of his name every morning. Martinez visited regularly, always brought Chloe, 11 years old now, scar on her head hidden by hair, bright eyes, full of life. She always hugged Maya, called her Aunt Maya. Maya always hugged back. The wall of former chiefs had changed, Webb's photo removed, just gone, like he'd never been there. Maya's photo in its place, young, serious, eyes that had seen too much but hadn't looked away. She led her residents to Trauma Bay 1. A young resident worked on a training mannequin, practicing emergency thoracotomy, the same procedure Maya had performed on the Secret Service agent 6 months ago. The resident's hands shook. Maya watched for a moment, then stepped forward. Precision, speed, confidence, that's how you save a life. The resident looked up, nervous. My hands keep shaking. Maya reached out, steadied them, her own hands perfectly still. I know that feeling. It goes away. When the moment comes, you'll be ready. She would know, because that's exactly what happened to her. The resident nodded, tried again, hands steadier now. Maya stepped back, watched, corrected technique, encouraged. This was what James would have wanted, what the 17 soldiers would have wanted. Not failure, not guilt, not hiding, teaching, leading, saving. The ER buzzed around her, organized chaos, controlled emergency, lives hanging in balance, and in the center of it all, Maya Rivera. Not just a student nurse anymore, not just a captain, not just someone running from failure, a leader, a surgeon, a teacher, someone who understood that saving lives meant carrying the weight of the ones you couldn't save, someone who knew that steady hands came from surviving the shaking, someone who proved that the best leaders were the ones who knew what failure cost. Dr. Maya Rivera, Chief of Trauma Surgery, exactly who she was always meant to be. Her hands moved, steady, sure, ready. Another patient arrived, trauma alert, critical. Maya's residents looked at her. She looked back, nodded once. Let's go to work. And they did. Because that's what heroes do. They show up, they save lives, they remember the fallen, and they never, ever stop fighting. The ER doors closed behind them, ready for whatever came next, always ready.